Good day and welcome friends. Today we will be discussing about the relationship between hospital staffs and patient, and that excludes the doctor-patient relationship, which we will be seeing in a separate video. Life survives on the strength of relationships, and this is true for hospitals. Most hospitals today are increasingly patient centric to improve patient satisfaction. Let's look at the different relationships in a hospital setup. This would include the nurse, which is a strong trust based relationship, the medical assistant, which is more of a emotional bonding, the administrative staff relationship, which is more financial, and other such relationships. First and foremost is the nurse-patient relationship. Now this is an interaction aimed to enhance the well-being of the patient. This enables nurses to spend quality time to connect, to interact with their patients as well as to understand their patient's need. This relationship is based on trust and respect and goes a long way in improving the patient's overall health. Nurses should serve as a caregiver, counselor, educator, and well-wisher for the patient. There are four important phases for the nurse-patient relationship. The first phase is the pre-interaction phase. This is the phase where the nurse orients or prepares herself, gets background information about the patients she is going to deal with and plans her objectives. The second phase is actual orientation phase. This is the first meet between the patient and the nurse, where the nurse establishes contact and finds out why the patient sought help and whether it was voluntary. The third phase is the working or therapeutic phase, where the nurse identifies the problems and encourages the patient to socialize and use new patterns of behavior for his well-being. The last is the termination phase, where the relationship is terminated and establishes mechanism for future therapy. The role of a medical assistant or a general healthcare assistant is a more closer emotional relationship as they take care of individual patients' needs like feeding, cleaning and helping the patient use the restroom, etc. It is more healthy and strong relationship which helps the patient recover and heal quickly. Other relationships include the role of an administrative staff, which is a business-like relationship and deals with settling the financial bills to cover the patient's stay in the hospital. It is a formal and cordial relationship. The hospital dietitian is a one-end off relationship where the dietitian deals with the food which the patient has to be given during his hospital stay, and it is usually done by talking with the patient and taking into account his health conditions. Other relationships include the cleaners, the ward assistants who are cordial and help in maintaining the patient's immediate surroundings neat and clean to prevent any risk of infection to the patient. Any relationship with the patient in the hospital needs utmost care, patience, sympathy, empathy, mutual respect, and sincerity. These hospital relationships help the patient develop a positive outlook which may go a long way in improving his physical health for which he is admitted in the hospital. Thank you and have a nice day.